Hello, everyone. Welcome to Health Talk Show. Today, I'm delighted to invite one of my friends, Dr. Kathy Parmele.
Hi,
Hi,
how
how
are
are
you?
you?
Great, how are you?
So, Kathy, you are currently on the front lines. You are an emergency medicine physician at Calvert Health Medical Center, and you're
Yes,
also director of wellness at that emergency medicine center.
yes.
And I'm very happy that you took the time today to come and join me.
Thank you for inviting me.
Your services, what you're doing these days for us, for as a whole, as a nation, is much appreciated. I hope you're doing well.
I am, thank you.
Okay, great. I want to start with our some of the questions that I would like to know that would help us understand your life journey as a physician.
Sure.
So, tell us a little bit about how did you decide to become a physician?
Well, I thought I was going to be a genetic engineer, actually.
Interesting.
That was back in the day when everything was getting really exciting in that field. And I went to Harvard and majored in biochemistry. I did research at Cold Spring Harbor. I've done a lot of bench work. Actually was in the lab working on Drosophila model proteins for a few years, actually 4 years, all 4 years in college. But then I started volunteering at Boston Children's Hospital as a interpreter for patients who were coming in from Greece who were having some issues involving cardiovascular systems that Boston Children's Hospital was helping them with. And I was just volunteering as a translator. And I found that I was getting a lot out of that, kind of a lot more out of the volunteer experience than I was than working in Drosophila genes.
Yeah,
So, so I actually decided that being a physician was really my calling.
was your calling.
Mhm.
Um, so at that time, did you did you find that the human connection and being able to help people in pain was your real calling, and you could relate to them?
Yes, and I could blend my love for science with
Yeah.
my desire to help others, and so that seemed like a perfect fit.
Okay, well, I'm glad that you were able to have that option at that time. Now, you decided to finish your college at Harvard University, and then you came to University of UPenn for medicine in
Yes,
Philadelphia. So, tell us a
yes.
little bit about that choice of that medical school and how was life in Philly?
Yeah, so I was so excited that I got into Penn. It's an outstanding program. I was surrounded by incredibly intelligent people. I met and have lifelong friends. I actually met my husband, who's unfortunately now my ex-husband, but we met uh, just at the very
At Penn, huh?
beginning
Yeah.
at Penn, started dating there, got engaged during med school, got married. It's during the last year of med school. And then, I made some incredible friendships and connections there.
Wonderful. I want to take you to the next journey of your chapter of your life. You went to start your residency at in emergency medicine at University of Pittsburgh, another good place,
Yes.
another training good center. So, why did you decide to become an emergency medicine physician?
I realized that during medical school that what I enjoyed the most was the acute figuring out of a problem. So somebody comes in with an undifferentiated problem, um, a general complaint that may not really point you in the direction that you um, necessarily ultimately will go, but you're using clues from the history, the physical, the labs. You have to keep your mind open, otherwise you'll go down the wrong path. And I found that that was pretty exciting. And I realized that there's a part of me that really likes the adrenaline rush of
I
the
was
ER.
gonna say the
Yeah,
adrenaline rush. Yeah.
yeah, and just kind of go 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 go. But then when you're done, you can go home, and
Yeah. You have to be really present at the moment in
you
emergency medicine, right?
you
Because if you're
really do.
daydreaming, like, and you're distracted, you would miss important information. And
Absolutely.
how busy was those days in emergency rooms? Is there any?
I mean, quite busy. These are level one trauma centers that we worked in. So,
Yeah.
and University of Pittsburgh is an amazing residency program. They really they value their residents. They give us a lot of responsibility, and the other part that I loved about it was the pre-hospital system. So we had a Jeep that was manned 24 hours a day by one of the residents. So we would go to all cardiac arrests in the city, all SWAT team,
That's
yeah,
unusual. That's
anything.
a very new thing for me. So there
Mhm.
is a Jeep that actually you guys are like on the wheels and just
Oh yeah,
going in
yeah,
on the
yeah,
scene.
and oh,
Interesting.
absolutely. We'd go to every cardiac arrest, every major call, and acted as the physician consultant. But that wasn't it. It wasn't just the Jeep. It was also we also had a helicopter shifts, so
Wow.
we were flight
That
physicians as well.
that would be a fun thing to do, and definitely an adrenaline rush is I can see that. Uh, what what is one thing that you really loved in the emergency room? Was there any certain kind of patients you always enjoyed talking to? Maybe the kids, older folks, some drunk that is always showing up on your doorstep, and you're like, John, you're back
Uh,
again.
yeah, well, you do have your frequent flyers.
Yeah.
That's true. What is my favorite? Gosh, I don't know. I have to say, I do really like my little old ladies and little
Yeah.
old gentlemen. I have
I
to
think they're
say, I
sometimes
have
so
a really
cute.
warm
Yeah.
place in my heart for them. And
I
while
feel,
sometimes it could be a little frustrating trying to get a history from them
yeah,
because
yeah.
it takes
They're
a long time. They're
especially when they come in with a fall and their hip is broken and they're like, what happened to me? Like, okay.
it's these people have lived such long lives, and if you just ask them, if you make the time, which is sometimes a challenge, but if you
Yeah.
ask them about their history, they're just they're gems. It's just like a treasure chest full of wonderful information. So
Yeah.
yeah.
Now, as an emergency medicine physician, you were in Pittsburgh. When you finished your residency, life took you to your current job. I feel maybe there was one job in between, but it was in Pittsburgh, and then you eventually came to, is it Maryland right now? That's where you are?
Yes. Mhm.
So tell us a little bit about this, your current position, and your life journey so far for the
So
last
I've
maybe
yeah
16, 17 years, or maybe
19
19
years.
years. Yeah.
And for 19 years, I've been in this same hospital.
Yeah.
So we moved here in 2001, and I started working at Calvert when it was a very small community hospital. I think we had 23,000 patient visits per year at that time. Um, Only three physicians on any given 24-hour period, and it was uh, very community based. Uh, Sorry if you hear background noise. There's jet skiers.
Jet
uh,
skiers. Okay, you
Jet
have to show
skiers,
us
yeah.
around eventually when we get
Okay,
into the fun part. Yeah.
sure, sure, sure. Um, so I've actually been there and watched this community hospital grow, and it's a pleasure working in a place where you feel like the people that you work with are family.
I can see that. I mean, it's a lifetime. I mean, people now
Mhm.
work 5 years and they feel like that, they start itching about moving places. You never thought you're gonna just, change places. You just fell in love with this place.
I did, and it's so having gone to Ivy League schools, and there are pressures of sometimes there are pressures of people telling you, well, you know, you're so smart, you should do this.
Yeah.
You should
Yeah.
do academic medicine. You know, you've been doing research for years. You should do X,
Yeah.
Y, or Z. But then you have to really think, okay, who am I doing this for?
Yeah.
And what am I trying to get out of my life? And if the answer is, I'm doing this for me, and what I love is the patient connection, and what I also love is having the ability to have the time away from the hospital be my downtime. Um, you know, I
You
realized
don't want
that,
to sacrifice that totally, right? Yeah, just
right,
for living a life
exactly,
for others.
right,
And the
exactly.
and the service that you're providing here, you're making difference in people's life, that in itself is like, priceless. But you have been a teaching physician also in this profession. You have also gone into wellness. What
Yes.
triggered to and explore wellness as part of emergency medicine? It's in you're thinking outside the box here, and I'm trying to understand what led you to this journey.
Yeah, you'd be surprised how many emergency physicians actually are
Looking
thinking
into
about
that.
transitioning. Yeah.
Interesting.
So,
Okay.
so, um, so first of all, I found that I live a fairly healthy life, I feel. I've always been athletic. I've always loved to cook. I'm an immigrant from Greece, and so um, cooking is just, it's just what we do, and cooking from scratch. And, I don't think about trying to go out and buy food. I think it's much easier for me to just whip something up at home.
Yeah.
Um, and I was finding that despite those healthy habits, I actually, let's back up for a little bit. I was working nights.
Okay.
Um, I've been working night shift for about, like, full on night shift for about 15 years. And the reason why I did that was because my husband at the time was a pediatrician. And we could not properly take care of the children. um, I have two children. I have a boy and a girl, and we could not properly take care of them with me having an ER schedule, a typical ER schedule, because the afternoons and evenings, most of the
Yeah.
time you're in the hospital. So I had to do nights to have a regular schedule, and I was working 4 nights a week. I was acting as my daughter's soccer coach. I had a whole team that I was in charge of. So 3 days a week plus weekends. Um, and
It's very
after a
hectic.
while,
Sounds like, yeah.
yeah, after a
Extremely
while,
hectic. Yeah.
and I felt like, I could do this.
Yeah.
You kind of feel like, oh, I'm a warrior, right? And, but after a while, it starts to wear you down. And then while that's going on personally in the hospital, things are getting busier. All of a sudden now we've got patient satisfaction scores and metrics, and you have to go faster, faster, faster. And they are starting, once we get EMR now,
Yeah.
you can have, people can see how long did it take you to actually go in and see a patient? How long did it take you to discharge someone? So these pressures that weren't there during training, that weren't there at the beginning of my career when everything was paper, I feel like I'm aging myself, but back when I started, we would actually physically, uh, not personally, but, films were hand dipped, right? And
Interesting.
so,
Yeah. Yeah.
that wasn't a pressure there.
Yeah.
So
It's
I
all
found that if
digital
I,
now, and it's like quick and fast and do more
yeah,
fast. Yeah. So that
exactly. And
the
so,
fast-paced life was just, and my question is, I can see that, there is a uniqueness about you, with your background from Greece, loving a balanced life, having to be able to cook at home, time with your family, with your kids, pursuing that passion, and then doing nights all the time, with that pressure. You can hardly ever have a good sleep, and I think that it can be a source of extreme prolonged fatigue that you can never come out of,
Yeah,
because
so
the
I
sleep
had
cycle is all messed up all the time.
always,
You know,
but and at that time I had a room in the basement, everything was super dark. I really tried to practice sleep hygiene.
yeah,
I'm actually a very good sleeper.
interesting.
So I think
Yeah.
that has helped. But I
Uh,
found myself crying before my shifts.
Yeah, is that right? Wow. I know I've done some nights, and especially my nights, like I get a bout of depression, like a series of depression if I do a couple of nights, um, just for sharing my thoughts, that in somebody doing for 15 years, it's like, for me it's like a lifetime of sacrifice. So it's a lot. So
Mm.
tell me a little bit about what happened, because I'm trying to get to the point of uh, what is the dream job of a ER physician? Is it something that you are now in, or are you still trying to create that environment for you, that you have a more balanced life? How is this ER life now going for you at the moment?
Right. So that's a great question. So as I mentioned, this is going to take a second, but I'm from Greece, and my family in Greece has, like, we live very simply. And I found that with little money, they had wonderful lives, very fulfilled,
Hmm.
happy lives. And so I realized that I did not need to work full time to be satisfied.
Yeah,
I don't need all that money if I live more simply.
sure.
And so I had to cut back. And so for me, my idea of a balanced life, and actually emergency medicine allows you to do that. I ended up going from 4 nights a week to 3 nights a week, and now to 2 nights a week. And so I'm part-time, 2 nights a week. Um, and then on my days off, um, I I actually now practice as a health and wellness coach, and I'm able to have time to work on my garden, to exercise, to cook, to connect with my family, to travel, and to do all the things that, you know, pay bills,
Yeah.
in the
Now I can
house.
see the connections. Now I'm seeing how things are aligning together. So, your 15 plus years of intense work led you to realize you're kind of getting to a point of burnout. And then you realize, okay, I am satisfied with what God has given me, my life. I need to enjoy that. So you pulled back a little bit on time. But then you found another way of helping people through uh, being a life coach, a wellness coach.
Right.
And so, right now, from where you are in the future, if you see yourself, if you could actually create a dream job, a profession, a career for you, what would you like to see now happening?
So I'm actually working on that right now, as far as, what will my transition,
Would look
be
like, yeah.
someday. And I'm not ready to do that anytime soon, but ultimately it is in the realm of lifestyle medicine, functional medicine, health and wellness coaching. Actually, I'm planning a to start doing some health and wellness retreats in Greece.
I saw that on your
Actually, yeah,
website, so
yeah,
I want to talk to you about it. You are a member of American College of Lifestyle Medicine. You
yes.
are also part of Well Coaches, Wellness Lifestyle Medicine Coach certified, and another, you're a member of Council of Directors True Health Initiative. I think it's by Dr.
David
Katz,
Katz.
David Katz. Yeah. So tell us a little bit about that part.
The ACLM and the well coaches and
Yeah,
the
yeah, lifestyle. How did you explore that, and
yeah.
how did you become a lifestyle physician?
Well, when I realized that, actually it was an aha moment, and it was a moment that I met with my director of the emergency department, and I, even at 2 nights a week, I was struggling. And I think part of that had to do with, I was also struggling in my personal life as well. Um, and I kind of came to her with a list of demands, and
That
looking back,
here it is.
she was so sweet, so kind, just the absolute best kind of leader that you would hope for. And she looked at me and she said, okay, I support you in whatever decision you want to make. I just am wondering, what do you have to offer? And that just kind of like, took me aback. I was like,
Yeah.
part of me thought, I'm offering everything, my whole life I'm offering. But it was like an aha moment. I kid you not. I felt like the sky opened, these rays came down, and it was like, I felt like a robot. Like, I would like to help my colleagues with their wellness. I was like, who said that? Like, where'd that come from? It was not something I had ever really thought
Oh,
of. And this was January 6th, 2017. And I will tell you that that is Epiphany Day. And literally in the Greek tradition and other, and it was like an epiphany for me. And that's when I decided to sign up for to be a member of American College of Lifestyle Medicine, because I was like, well, what physicians are interested in wellness? Oh, lifestyle medicine.
yeah.
um, I then became director of wellness, and kind of shot off in that direction. That's all it took, was that question.
So, Kathy, are you finding that you are not alone in that emergency room or in this profession? Have you, because on your blog, I noticed that there are stories from other health professionals.
Right.
What did you explore then? What did you find it out?
Right. So I knew that if I was having trouble,
Yeah.
um, because I feel like I'm a strong person, in many ways. I feel like I am resilient. I feel like I do have healthy habits, and I felt like, we're not talking about this because nobody around me is mentioning that they're having trouble. And I think this is a little bit of a problem that we all have, because we've been brought up to feel like if we mention that we're having any issues, we're considered weak.
Yeah.
And that was the worst thing you could be called in residency, is weak.
Yeah.
And but I decided I'm going to let people know that I'm having a problem. And once I did that, once I showed my vulnerability, once I took that shield off, dropped it, took the armor off, people started coming to me, like, oh, we feel the same way.
Yeah.
It's like, what? They said, thank God you said something. I never would have thought that you would
Would be
feel
the,
this way.
yeah.
And once I started bringing it up, people were coming to me and saying, oh, I feel this way as well. And in emergency medicine especially, we are constantly getting hammered with tragedy after tragedy after tragedy in the emergency department. It's illness, it's pain, it's sadness. Nobody wants to be there.
Yeah.
Nobody is happy to see you. You're at a job where everybody's upset that they're there.
They're
All
there.
the
Yeah.
patients, the patients' families, they're, either
They're
it's too
scared.
slow, they're
Yeah.
scared, they're in pain, they don't understand why they're waiting. They're not seeing their doctor. So who is this random person that's here to take care of them? And we kind of have to suffer the brunt of that day in, day out, day or night in, night out. And it
It
wears on
wears you.
you.
Yeah, it wears on
It
you. Yeah.
wears you down. And so I was actually really excited to see that 2 years ago there's a wellness committee for emergency medicine, and they sponsored a retreat, and I managed to get invited last minute meaning like 3 or 4 days before the retreat, to speak.
To
And
speak.
um,
Yeah.
and uh, and same thing. The stories. It's we're not alone. When you feel like you're alone in the way that you're feeling, you're not. And this is not emergency medicine only,
Yeah.
obviously.
It's many of the physicians. Do you find that there is a discrepancy between how men and women in this same field as a profession of medicine express themselves? What do you see the difference? Like I can see that between a woman and a woman, they can come and talk to each other at a much easier, a deeper level. But do you find men also coming up to you, doctor, physician, and saying they're talking to you about their problems?
Yes. So, I think I don't think that there's that much of a difference, to be honest with you, because a
Okay.
lot of female physicians have really had to almost really express the masculine side of their being in
Yeah.
order to feel like they could
Mm.
be taken seriously in this field. And so I sometimes it's maybe a little bit harder for women to open up because that's showing the vulnerable side of them that they've been trying to hold back. But we
Yeah.
all have masculine and we all have feminine energies.
Exactly.
And once you show people that, I am open, I'm an open book, this stuff is hurting me, then that person can feel like, oh, I can relate and I can talk to you. And so I've had men and women open up
Mm.
to me pretty much equally.
So, Kathy, what do you see the roadblocks that we as physicians or we as professionals have in expressing that? Are we afraid of being called weak, as you said? Are we afraid to lose our jobs? What do you think are the roadblocks in making this as a normal part of our society?
Well, you know, as physicians, we are leaders. The community looks up to us,
Mm.
and I think we put ourselves. We ask a lot of ourselves. We um, almost ask more of ourselves than we would of any other person that we deal with, and I feel like it is a sense of weakness that you don't want to let other people know that you're struggling because
Yeah.
that might make you seem incompetent or unable to do your job properly.
I agree with you. And another thing I want to ask you is, sometimes before COVID-19, if I was not feeling well and I'm under the weather or I have some low-grade fever, I would just suck it up. I would
Oh
keep
yeah,
going rather than canceling my clinic the next day. I would like, how many people are gonna get affected, and I think that's also another part of it. Like if I can't help this person in crisis and I bring up my issue, who's gonna help them? Like that
right.
kind of concept also comes.
Oh, I've been known. I had gastroenteritis one shift.
Yeah,
I felt terrible before I went in. I went in 30 minutes earlier to get an IV, to get
to
hydrated,
hydrate
to
it to
get
work, huh?
Zofran, and I actually carried my IV pole with me from room to room to take care of patients.
My gosh. See,
Mm.
you should have been on CNN that day, but you're here. So let me ask you, going through day and or nights of emergency room medicine, and then going through this extreme level of stress carrying on you the weight, and then you came out as a lifestyle physician. What's making you stronger and resilient, and what's moving you forward now?
Part of it has to do with so I in 2017 when I joined ACLM, I realized I needed to find out more about other aspects. So I was okay with exercise. I was okay with diet. I actually felt like I did a good job sleeping considering that I worked nights. But one thing that I was not really all that good at was number one, opening up to others. So
Hmm.
being vulnerable and socially connecting. And number two is meditation. Um, so I decided, what, I'm going to look into this because it can't possibly be, so many millions of people practicing it. And, there's got to be something behind it. And I started meditating and I found that was actually the game changer for me.